Yeah, good morning to you both. Here today at London Ambulance Service, we're going to see paramedics and ambulance technicians walking out along with emergency care assistants and 999 call handlers as well. Of course, this all dates back to that pay rise offer, a 4% pay rise offer in September, which was turned down because it's below the rate of inflation. And ambulance workers and staff that I've been chatting to this morning as they've been coming and going from their very busy shifts and looking absolutely exhausted, those leaving, by the way, are telling me that they, in many cases, are needing to use food banks and are struggling financially to a significant extent, and just very worried that also people are leaving the service, choosing to leave the service because of the pay, because of the conditions, and looking for alternative employment. Well, I'm joined now by Eddie Brand. He's an emergency medical technician. He's also the branch secretary of the London Ambulance Service for Unison. Eddie, good morning to you. Now, why have ambulance workers decided to take this action today?
I think, well, you mentioned about the pay rise that we should have got last April and ended up getting in September, which is obviously well below inflation. And it's also about safe staffing. It's about what we're doing for the public. We're unable to do a proper job. The job that we're paid for is because the social care system's a breaking point. If not, it's already broken. So we need to do something because it's not fair on our staff and it's not fair on our patients.
In terms of the government, what do you need to hear from them to prevent further days of strike action? Obviously, I know other regions of the country are being balloted at the moment to see whether they will be going on strike. What do you need to hear? What's the bottom line?
Well, we just need them to start talking to our negotiators. They need to get our unions, all the unions, they need to get them in and get round the table and start meaningful talks. That's what we need.
In terms of patient safety, obviously we know that only the most emergency calls will be answered, cardiac arrests and so on, real risks to life. They're going to be the priority for the ambulance service today. What's your concern for patients today?
So we will provide life and limb cover from the picket lines. So our striking members, we've got delegations with our service. So our striking members at each picket line across London will respond. If the service can't cover it, the service, our pickets will respond to life-threatening calls, and we've done that over the last strikes that we've taken from December up until now. So there's going to be no different. We're going to help Londoners.
I was talking to one gentleman who was sweeping up along the streets here, and he was saying to me that even before the strike started happening, there was trouble with the ambulance service response times, and a member of his family was denied an ambulance when they called for an emergency. They had to take her to the hospital themselves just because there was just such a shortage, and this is just going to exacerbate the problem, isn't it?
We don't want it to. That's the problem. We want them to get round the table. We've got to stand up for ourselves, and we've got to stand up for our members. Our members are telling us they want to take the action, and our members have had enough. We're being treated with contempt. So we don't want to hurt people. Of course we don't. And as I said, we will go to the life-threatening calls. We will help them. This may delay some ambulance calls for the people that are not as unwell or not as injured as the calls that we're going to go to. But we will do our best to look after them.
Eddie Brand, thank you very much. Appreciate it. Well, there you go. You've heard the views here from the picket line. That officially opens at 11 a.m. this morning, and I'll be speaking to many of those taking part in the action today, finding out about how and why they need this pay rise and how it's affecting their lives.